Fraser Health has advised doctors and clinics in the region that the goal is to have mass public clinics up and running starting April the 6th. Is that also the target for the whole province, and what hurdles still need to be cleared to get there?
Yeah, so that is the bigger clinics that we're having in the 172 communities, and we'll be talking, as Minister Dix mentioned on Monday, more details about that. But in the meantime, we are targeting people who are 80 and above, and they'll be slightly different. Some of them will be the mass clinics, and some of them will be tailored more to the people that we're targeting in that group. So many of them, many of our seniors are people who live in independent living or receive home care, and so we're doing a mixture of making sure that we can get to our most elderly people as efficiently as possible.
Vaughn, do you have a follow-up?
Yes, please. Fraser Health is also saying, and you referred to recruiting people as immunizers. Fraser Health is saying that at the peak, clinics will require as many as 500 immunizers per day, and they're also saying that they expect the uptake of the vaccine will be in the 80 to 85% range. Are those numbers sort of ballpark for the whole province? And in terms of implications, how big a recruitment drive are you going to be into on this if that's the case?
Well, that gives you some indication of the scale. And yes, we are looking at, we have run mass clinics before, and this is going to be a big scale, at a scale that we've not done in many, many years. And it will be prolonged. So this is not something that's going to just take, I think back to 2009 when we had the influenza pandemic and we had mass immunization clinics and provided vaccine to millions of people within a very short period of time. This is a different goal here. It's more people, it's a broader swath of the population over the entire geographic area with vaccines that are fussy. So yes, we are looking at, those are some of the parameters that we've been planning towards in all of the health authorities to get these clinics up and running. And yes, we are looking at large numbers of people, which is one of the reasons I put the order in the last today about being able to recruit people to work over time in these clinics to provide different functions. So there's a whole lot of things that go into a clinic besides just putting the vaccine in one's arm. So there's a lot of things that, whether it's registration, whether it's making sure that we have people, especially if we're talking about our frail elderly and older people coming into clinics, having somebody to make sure that the experience, they're able to support them going through the clinic, people monitoring afterwards for adverse effects. And, those are all the things that we've been planning for in great detail over the last number of weeks. Yeah.
I think I noted this when I was describing what's happened to date. I think that very effectively we've addressed some complex situations. It's and the health authorities, including the First Nations health authorities, have done, I think, a very good job so far of addressing the situation in long-term care and assisted living in hospital circumstances, in dealing with some emerging situations in communities, in going to rural and remote Indigenous communities and providing support from Nishka to Hartley Bay, all to Cowichan. So in all of those cases, the effort by health authorities has been, I think, excellent in dealing with some of our most vulnerable populations in the province and providing them with care. We're entering into a new phase. This is what Dr. Ballin has been leading, working with Deputy Minister Steve Brown, with Dr. Bonnie Henry, but then thousands of people will be involved in this. Indeed, I'd argue tens of thousands of people will be involved in this immunization campaign in the coming months. And so those are the details we'll be providing. With respect to whether one health authority is different than another, there are different circumstances in the north where populations are spread out and more isolated than they are in large metropolitan areas that are represented by Fraser Health. But basically the core of it will be the same province-wide. And the work is being done now to prepare for that. We're identifying the sites, and over the next number of days, you'll hear from different municipalities who've identified particular sites. I think we heard from Surrey yesterday. We might have heard from Langford last week about sites that have already been agreed to. But this is going to be an extraordinary campaign. What you're going to see in the next 2 weeks that's a little different from March 1st to 15th is particularly in dealing with people who receive public home support is an effort also, and this will be required with certain groups of people and a subpopulation of the people over 80 who we need to reach in their own homes or in their own residence. And so some of that work will happen now. So we continue to focus on those groups, and we'll have the broader information that Dr. Ballin will be presenting with our support next Monday.